This afternoon, 10 on Your Side brings you a special coronavirus digital discussion about the pandemic. We have these on most Monday afternoons at 1:15, and today we are talking specifically about some of the frustrations of the COVID-19 vaccine distribution process. Joining us this afternoon is Norfolk City Councilman Tommy Smiegel. Welcome, Tommy.
Thanks for having me, Stephanie. Glad to be here.
Yeah, and thank you for all you're doing and for taking time to answer our questions. You know, you have gone on record, I know, calling this vaccination rollout process a hot mess from the federal level right on down. Do you care to elaborate on that for us?
Absolutely. So, I had no other words to describe it other than a hot mess and, getting that from my own young children. But from the rollout from the federal government from the very beginning, there just was not coordination or organization down to the state, and then the state to the localities. And they've really left it up to the localities to kind of help out and assist with making sure the process is smooth. And that was never the intentions that we were aware of as a locality, but we felt obligated to do it. So we're really helping to make sure that this is as smooth as possible.
And as you just mentioned, you're helping out because this is not the city's job. The city doesn't have authority over this process. This is the health department. So what have you as a city council, and you in particular, done to try to jump in and help to make this process a little smoother for the residents of Norfolk?
So you're absolutely right. The Virginia Department of Health is ultimately the authority when it comes to the vaccinations. We have a local health district called the Norfolk Health District. So a lot of people associate that with the city of Norfolk. And we share a health district director with Virginia Beach. So Virginia Beach has their own health department as well. But the city of Norfolk, our team, Norfolk, has really stepped up, starting with our city manager and his team, with providing locations, for that. So our major vaccination site is Macy's, which the city of Norfolk owns, the former Macy's site at Military Circle. But we've also been helping with communication, including setting up a call center. So if you call 664-SHOT in Norfolk, it's actually City of Norfolk employees that are answering that phone call and helping with getting the correct information for citizens. We've also opened up rec centers throughout the city in targeted areas to help people who don't have technology to register the vaccine or have questions. And we provide city staff, including our EMT, our firefighters, have actually been vaccinating our citizens. And so it's been an all hands on deck. But once again, remember, it was never any intentions that the localities would actually do that. But we feel obligated to make sure we get as many shots in Norfolk citizens' arms as possible.
So, Tommy, that being said, the city has stepped up in a lot of ways to help with this process. Were you asked to do that, or do you feel like, in a way, VDH dropped the ball and you guys just came in and picked it up?
I think, yes, some balls were dropped. And that's, my opinion. And I think some of my colleagues on council will tell you the same thing, that it just was not coordinated, even from the management system for the scheduling was a disaster. Now that came from the federal government, but that's been replaced. Then they found some loopholes in it as well, that you could share the link and multiple people could register. These are all things that are beyond a city's control, but we feel that we have to do this, including us helping with targeting specific populations in Norfolk, particularly our Black and Brown citizens. Where we've seen a higher percentage of hospitalizations and deaths, almost 70% in Norfolk. And so we've been helping, actually we have a data center that is pulling by zip code and helping the Virginia Department of Health advertise specifically into our areas of highest need. And it's frustrating. It's very frustrating for citizens too. And they're anxious, they're afraid. They want to get the vaccine, but quite frankly, there's not enough, Stephanie. Mm-hmm. There's only 2,700 we get every week. And half of those are put aside too for second dosages, and some of them have to be given to other private. We have to share those vaccines. And so there's just not enough for the amount of people who need to get the vaccine right now in phase 1B.
So let's talk about that. There's about 47,000, I think it was, that qualify in Group 1B just in Norfolk, and at doing 2,000 a week, we could be doing this forever. Is there any hope on the horizon that you are being told about getting more vaccine into Norfolk anytime soon?
So we know that vaccinations, the state was only receiving 105,000 a week, and that number has increased to 129,000. Still not a huge amount, but it will bump up a little bit as they come to the localities, and that they go to the localities based on population. And of course, as you saw, the federal government is sending vaccines through CVS and private pharmacies, so that will assist. But you're absolutely right. This is why when citizens register that fall in 1B or 1A even, they're told that it could take 4 to 8 weeks. That is not a lie. That's what it is. And I think that's where the frustration comes, is when you're, say, on social media and you see somebody post, I was able to get the vaccine today, and they're in the same category as somebody who hasn't received it. There's no conspiracy theory or rhyme or reason why that person got it. It's just getting in as many as we can. And remember too that these are all federal vaccinations. So if you're an employee in 1B and you work in Norfolk and you are registered through the city of Norfolk, but you may live in another city, you're getting a Norfolk vaccine even though you live in another city. And so we're in Hampton Roads, people are getting vaccinated in various cities depending on their employer group, such as Norfolk Public Schools teachers. Many of them were vaccinated in a clinic, but teachers live all throughout Hampton Roads. But that's a Norfolk vaccine that's going in their arms. And so that's one piece of clarity that people, I think, need to know about how vaccines work, is we can't turn away people just because you don't live in the city of Norfolk if you qualify under 1B and you've been registered through our health department.
Yeah, it's very frustrating. And some other things that people are frustrated about, you mentioned CVS when they opened up last week, and I think a lot of folks thought that if they were pre-registered already through the Department of Health, that their name would be picked up now automatically through CVS and they would go, start receiving phone calls. But that's not the case. CVS started their own.
Absolutely, and we just found that out too. So it's another thing that we have to respond to as a locality, because ultimately the questions come into us. And as you see, Stephanie, I'm very active on social media, trying to get out information as much as possible to our citizens, but these types of things that come up just make it even more confusing. I will tell you that if our citizens do call, Norfolk citizens who have pre-registered and they just want to verify that they are on the list still, they can call 664-SHOT. And our Norfolk employees can work to help make sure that you are on the list. But it is a waiting process, unfortunately, until those vaccines increase, the amount of vaccines coming in increase.
So let me ask you about this list, because tomorrow the State Health Department is going to open up a statewide pre-registration call center. And so far we, as the media, have very little information on this. They have not shared a lot at all. What might you know about it? And from what you've said before about from the federal on down to the local level, do you trust it?
So I'm smiling there, Stephanie, because we want to trust the process, and I really want our citizens to register. When you're eligible, you need to register and get that in. We have been told that anybody who has registered under the old system will transfer over to the new system. But just in case, the city of Norfolk is keeping our list. We're keeping everything together just in case before that transfer, and we're keeping our form open, and we will transfer the names to the Virginia Department of Health. But you're right, there's some uncertainty with it. We want to make sure that everything runs smooth with that transition. Kind of what happened, the system can get overwhelmed. I truly believe that 1B was too big of a group to advertise to, and that's kind of what happened. It flooded the system and it got people anxious. It's really looking at those smaller groups within 1B. We want to get our 75 and up. We want to get our 65 and up. We want to get our teachers, all of our healthcare workers that weren't vaccinated in 1A, our firefighters, our frontline workers. But that should have been done in parts and pieces, which I think overwhelm the system. And that's my concern too, is that every time you have a new system, do you overwhelm it when you get people now thinking, oh, I registered already, so I need to register under the new system. We have been told that you don't have to do that. That you can, if you've already registered, everything will get transferred over. But we'll keep our list in Norfolk and continue to communicate with the state to make sure that it is smooth.
Yeah, and you can understand why, of course, people are frustrated when they see what they are considering to be line jumpers, if you will, people getting ahead of them in the line, or they see somebody post on social media, as I'm sure you have, somebody who maybe is on the board of a hospital who doesn't even work in the hospital system, or somebody who does data and records for a hospital who's been working at home for months, if not years, before this ever happened, and they're getting vaccinated with no other pre-existing conditions. it's really frustrating for those citizens out there, especially those over 65.
I agree 100%. I'm just as frustrated as I'm one of the people who receives the complaints, from citizens on it. And, it's unfortunate because really our answer is you have to be patient. We don't have control over that. And really, when those vaccines came in initially, they went to all the hospitals and then they, disseminated them throughout Hampton Roads. And so there was extras in those. And when those extras became open and available, that's when I think some of that process kind of got muddied. Now, anything extra has to go to the health department. Everything actually goes to the health department. They receive them, and now they're giving them out. So that process has been cleaned up. But it's tough, Stephanie. It's really, really hard, particularly if you talk to a citizen who is, older citizen that has underlying health conditions. They're scared or they want to spend time with their grandkids and they can't because they haven't received the vaccine yet. Right now we want to remind everybody to mask up, stay social distance, and if you're eligible, register and be patient. You will eventually get vaccinated. It is slow, but we do need those vaccines to increase. And we're hopeful that the federal government, they keep on announcing they're going to have another 100 million vaccines that are going to be available in March, that will trickle down to the states and then increase for us to be able to get those shots in our citizens' arms.
I think that's important to know what you said a minute ago about how when they were extra and where they were going, because according to the city manager's report for Norfolk from last week, 2,775 shots received, 2,200 people vaccinated. So some look at those numbers and say, well, where are the rest of the shots and why aren't they all being given out?
And I'm going to clarify that too, because I have some questions with myself. What I've been told is there is a lag in data collection. So not all of those vaccines are actually administered at Macy's and by the health department. Some of those went out to offices, to private offices even, to vaccinate their patients. And when that happens, there's a lag in the data collection of how those get reported that they've been administered. And so eventually it does catch up. But it's an interesting process with the numbers because you do see that, and also know that some of those have to be set aside as well for all those second doses that need to be administered that are coming up as well. So we're still not getting the full amount in to cover the second doses. And that's part of the numbers as well, which is pretty tough.
Sure.
When you look at how many have been administered already.
Yeah, people are worried about making sure they get that second dose in as well. I want to go back just for a minute. You talked about the staff last week helped hundreds of residents with that online registration form, and you've set up these sites throughout the city. And I know one in particular, I was seeing that that zip code you spoke of, Berkeley neighborhood, was really, really low in the number of people that were registering. And then you guys went out into that community. How do you think this has helped? Are you seeing it make a difference for those who are older, maybe not computer savvy, or maybe don't have the economic, means to get on a computer, have one at home?
Yeah, and I think Norfolk was great for setting that up. It really has helped. The manager in his weekend report said that we saw increases in numbers of registrations and zip codes. Interestingly enough, the two zip codes that have the most registrations are in the ward that I represent in Norfolk, 23518 and 23503. Maybe because more of my citizens have access to computers and in that technology to register. So this is a really good boost. I have to give a shout out to two of my council colleagues, Councilwoman Johnson and Royster, who went into the communities with flyers and handed them out to let their citizens know that how to register and what the process is. But there's also a fear of vaccines in general in the African American community. And so we want to make sure too that everybody understands that this is pretty safe. It doesn't help. Every once in a while you'll see a report of somebody who died after a vaccine, and the CDC will study that. But overall, this is a safe, vaccine and process. So that's why we really want to encourage our citizens to sign up. And we're going to help and do whatever we can. In part of my ward in the East Ocean View section, we have a center that was able to help out over 100 citizens this week. There's a high poverty area in that section. We are working, as much as we can to make sure that everybody's educated and understands what they need to do.
Yeah, and if anybody checks out your Facebook page or several of your colleagues out there, you guys are doing a great job. You're updating people, letting them know about the city manager's report every week. So I know they appreciate that, and we appreciate your time. Let me finish up by asking, going back to the very beginning, you called this whole process a hot mess. Do you think we're moving at least in the right direction, or is it still too messy for you?
I think we're moving in the right direction, and I think a lot of it is because the cleanup that the state has made, but also because of the city of Norfolk and what we've done. I can't speak for other cities, but I think that we are really working, hard to clean this up. Hot mess part is still there's not enough vaccinations.
Yeah.
For the demand. I mean, we already have 23,000 citizens in Norfolk that pre-registered in 1B or 1A that still have not received it, and 2,700 is not going to cut it. And you saw that 47,000 are eligible in Norfolk. We just need more vaccines. We need the federal government to step up production and get those vaccines to the state. Then we'll trickle down to the localities. Or they need to do the mass vaccinations where FEMA or the National Guard or the military gets involved with helping with it. We need something at that scale to really make sure that this happens as smooth as possible.
All right. Tommy Smiegel, thank you so much for joining us this afternoon. I really appreciate it.
I appreciate it. Thanks, Stephanie, for having me.
All right, and I'll have a recap of our digital conversation coming up for you later today on Wavy News 10 starting at 4 o'clock. Have a great afternoon. I'm Stephanie Harris, 10 on your side.